This is the final presentation of Team 23 on the application of Magnetorheological elastomers for tactile display in robotic minimally invasive surgery. In this presentation, we'll start with the introduction on the background and motivations, tactile display, general information on tactile display, and the problem statement. We'll continue with the design process. All the design elements will be provided, state-of-the-art tactile display, and MRE-based tactile displays will be talked about in this section, and we'll do some technical analysis on the MRE-based tactile displays, and we'll finish with some conclusions and recommendations for the future. Let's get on track by watching this video.
When I sit down at the console, I get into the zone. I'm one with the patient almost. It's like a dance. It's so precise. You know that the robot can augment and amplify my natural abilities. It's an incredible feeling to be a robotic surgeon.
Robotic surgery is a very complex laparoscopic surgery. The best way to describe that is there's a computer in between the physician and the patient.
The care we're providing, the hernia techniques we are performing here is like no other.
It immerses them inside the body. The high definition in 3D, they can see structures and vessels and nerves that you can't see with the naked eye. Robotics has allowed our physicians to offer our patients a better chance of leaving the hospital faster, less pain, less blood loss, quicker recovery. They get back to work faster. They get back to their family faster.
In robotic-assisted surgery, as you can see in the picture, tactile information cannot be transferred through the surgical instruments. Lack of sense of touch during the surgery could lead to vital tissue damage. As such, a tactile display is required to be adapted to the robotic minimally invasive surgery. Several tactile displays, which are generally consisted of controllable bulk and surface properties such as stiffness, roughness, texture, etc., have been proposed in the literature. Now that we know robotic minimally invasive surgery and the importance of tactile display to be adopted to this kind of surgery, let's take a quick review on the magnetorheological elastomers, MREs, and then we'll go through the problem statement. MREs are emerging class of smart materials that can change their properties in a reversible manner in real time under the application of magnetic and external magnetic field. They are composed of three major components: elastomeric matrix, ferromagnetic particles, and additives. The common fabrication constituent and concentration, maybe in the last 5 years, can be listed as 40% volume fraction of silicon rubber, 40% carbon iron particles, and 20% volume fraction silicon oil. What happens is that MREs can change their stiffness in real time. How? By increasing or decreasing the magnetic field, we can change the interparticle attraction force, and consequently, the stiffness of the material can be controlled in real time in almost around milliseconds. Problem statement. In this study, we would like to investigate the feasibility of using magnetorheological elastomers in design of stiffness tactile display. To this end, first we will examine and compare the available technologies for tactile display based on specific design elements. Having a solid grasp of literature, we will attempt to show the possibility of addressing all those issues with the current available technologies using novel characteristics of MREs as the design principle. The design elements for tactile displays can be listed as response time, stiffness or force range, power consumption, stiffness passivity, repeatability, electrical passivity, design simplicity, and disinfectability. These are mostly self-explanatory. Let's say for the response time, we can define it as the time that it takes from the system, the tactile display, to update its property, which is normally the force or the stiffness, to the desired value. It can be several milliseconds, hundreds of milliseconds, and these are all the design elements for tactile displays that we gathered from the literature. Several tactile displays have been proposed in the literature based on the different principles, which can be listed as DC motor, electroactive polymers, shape memory alloys, pneumatic, and magnetorheological fluid. Let's say for pneumatic-based tactile display, the device tries to rebuild tactile data with the application of pressure using balloon actuators. We did a great job by reviewing the literature and finding advantages and disadvantages of all the available tactile display principles. The properties that are highlighted are actually outlined are the properties, or I mean the advantages and disadvantages that are not marginal. Let's say for pneumatic based tactile display, the response time was really slow compared to all the other technologies. For electroactive polymers, the response time was pretty fast compared to all the other technologies. And we did this kind of comparison with all the available technologies, which all the results are summarized in this table. MRE-based tactile display in 2020, in January 2020, first MRE-based tactile display was proposed, which you can see its schematic on the left-hand side, and on the right we can see the actual design of this MRE tactile display. By controlling the distance between two sets of permanent magnets, it was possible to adjust the stiffness of MRE to the desired level. As you can see, there are two magnets. By changing the distance between these two, the stiffness of the MRE can be controlled in real time and can be adjusted to the stiffness of the tissue in the patient's body. Just keep in mind the direction of the touch and the magnetic field in this design are perpendicular to each other, which is one of the major drawbacks of this design. We'll get back to it at the end. Let's do some technical analysis. This beautiful graph was provided by the authors, which is the variation in the force, and which is the variation in the force with the indentation, which is sort of the deformation that's being applied on the MRE. This is provided in different magnetic field intensities. It was observed that for the indentation of 3 mm, contact forces was 4.6 under 70 millitesla flux density, while this increased to 12.87 Newton at 200 millitesla, corresponding to 180% MR effect or increase in the force. Then the stiffness was calculated by having the indentation and the force, and a surface was fitted into these curves, and the formulation of this surface was fed to the controller. Now that we have the force that's being applied by surgeon's hand and the stiffness, which is the desired stiffness of the tissue, the controller can adjust the magnetic field using this surface formulation to reach that desired stiffness. This study shows the capability of novel MRE-based tactile display system for the proposed medical application. The advantages of MRE-based tactile display can be listed as fast response time, broad stiffness range, stiffness passivity, repeatability, electrical passivity, design simplicity, and disinfectability. The only thing that we didn't brought in here is the power consumption, which is actually not valid for this study since they're using permanent magnets, but we think that we should use electromagnets in order to increase the response time of the tactile display, which requires high power consumption. But for this study, power consumption also can be one of the advantages of this MRE-based tactile display. We conclude that the applicability of MREs to be utilized in design of tactile displays. We actually verified this by comparison with the available technologies based on the major design elements reported in the literature. Some of the recommended areas to be further investigated can be listed as replacing permanent magnets with electromagnets, as I mentioned, and adjust the magnetic field direction to be in parallel with the motion. It has been reported in the literature numerously that in compression mode, the direction of the magnetic field should be in parallel with the motion. We actually proposed this design previously. An MRE based adaptive MRE spring element was proposed. This is cylindrical design. The coil are around the MRE, and the magnetic field intensity is in direction of the motion. Much more higher MR effect can be achieved with this design. The reference of this picture is available in the report. The third recommendation is utilizing anisotropic MREs to increase the MR effect. And at the end, we design multi-layer MRE with aluminum sheets between layers. This has been reported in the literature by using MREs, multi-layer MREs. Higher MR effect, much higher MR effect can be achieved, which we also learned through this course as well, how to design multi-layer structures. And thank you for your attention.